Hi, I'm Dr. Matson. Today we're covering population health for nurses. This is following the OpenStax textbook, Population Health for Nurses, Chapter 17, the Assessment, Analysis, and Diagnosis. In today's lecture, we're going to cover 4 important concepts in community health nursing, and that is the assessment tools and application to practice, assessing the individual and community needs for health education, analyzing population health data and identifying patterns, and formulating a nursing community diagnosis and plan of care. We're going to look at learning outcomes for the different sections throughout the lecture. So for this section, by the end, you should be able to differentiate among different assessment tools and data sources, so both primary and secondary, used to evaluate the health status of the population, community, and system, and then use a wide variety of sources and methods to assess public health information and conduct a community needs assessment that looks at self-resilient capabilities of the target population in order to help prioritize problems and health concerns. So the community health assessment, or CHA, is an assessment of populations, and in this process, the patient client is defined as the community or problem. So nurses and other healthcare professionals use a systematic approach to get this health-related data. So the timing of a CHA can vary. Sometimes it's done in response to a specific community need. For example, you can look up the Tijuana River crisis and see the assessment done in response to that. Or in other cases, there are laws and regulations that require institutions to conduct these at specific intervals. Typically, it's every 3 to 5 years. So for the County of Public Health in San Diego, you can look up and see when they have done theirs and read those reports. There are multiple models and frameworks and tools used to really guide the community health assessment. There are differences in approach, but they share common elements. So some of these elements that are shared are this organization and planning process, and then engaging the community to make sure there's partnership and ownership, and then developing a goal and vision that's reflecting this community need and value. And then after that, the assessment is collecting and analyzing data, and then gathering these findings. From there, it's going to be prioritizing health issues that are most significant based on this, looking at those priorities, and developing a community health improvement plan. This plan will then be implemented and monitored, and then evaluated and measured based on the goals and progress, and then this is used to guide future improvement. So the American Hospital Association developed a framework to help nonprofit hospitals comply with Internal Revenue Service regulations for community health assessment. So this framework is identifying community engagement as a central component, and then nurses are invited as community partners or stakeholders to participate in this process. So stakeholders include both community members who benefit from health services and those who provide them. So through this process, community members may form partnerships and relationships marked by mutual cooperation and shared responsibility. And when there are multiple groups and organizations that are joined together to address community needs, they form a coalition. So a coalition works collectively to solve community problems and improve health outcomes. So this picture here, what you're looking at is a community partnership that's brought together. And community partnerships really bring together the people who benefit from health services and those who provide health services. So you're looking at an example of a town hall meeting at a health center in Maryland. And this is really showing how community members and providers come together to share perspectives and identify priorities and plan for collective action. There are various steps that can be identified within the community health assessment toolkit, 9 in particular. So the first one is reflecting and strategizing. So you want to begin by clarifying your goals, looking at your resources, and a timeline for assessment. The second one is identifying and engaging community partners. So this involves stakeholders, community members, and you want to be able to identify them early. The third is defining your community. So decide on who or what population is the focus of your assessment. And then the fourth is collecting and analyzing the data. So you can look at both primary and secondary data to understand the community health assessment status. The fifth is prioritizing community health issues. So identify which problems are most urgent and actionable in your population that you're looking at. And then plan and implement strategies. So this is developing evidence-based actions to address the priority issues. Then the A step is implementing these strategies. So put these into a plan, into action, look at the programs and services and policy initiatives, and then evaluate the progress. So you want to measure outcomes and adjust the plan as needed. The MAP framework, so this is mobilizing for action through planning partnerships, originally had 6 steps, but then it went through redesign. So the MAP is a community-driven public health assessment tool looking at resources and needs of a community and how to address them. So this framework is looking at community engagement and collaboration, making it especially valuable for a system level of planning. And this framework that was revised includes now equity, inclusion, trusted relationships, community power, strategic collaboration, and data informed action, flexibility, and continuous improvement. So, in its updated version, MAP is streamlined into really 3 phases. The first is building a community health improvement infrastructure. The second one is to tell the community's story. That's very important. And then the third is continuously improve the community. So, this redesign is to provide clear, more flexible pathways for doing this community health assessment and guiding long term community improvement. Another tool is the Change tool. This was developed by the CDC for community members who want to improve communities' health. So, Change focuses on gathering and organizing data about a community asset and area for improvement. To guide this process, the CDC provides an action guide with worksheets and templates that lead communities through 8 action steps. So, the tool divides the community into 5 sectors. So it looks at the community at large, then the community institution and organization, healthcare, schools, and work sites. So by looking at each of these sectors, the communities can better see what the strengths are, identify the gaps, and then have a coordinated improvement effort. Another tool is the pre-seed proceed model, and this was developed by Crane and Krutler, and it looks at the social, ecological, and population level approach to guide health promotion strategies. So this model is emphasizing social determinants of health in the community's environment on the overall quality of life for that target population. So pre-seed is standing for predisposing, reinforcing, and enabling constructs in educational and environmental evaluation. The pre-seed process occurs before implementation, so this is focusing really on the planning and the assessment. Then PROCEED stands for policy, regulatory, organizational constructs, and educational and environmental development. So the PROCEED component has 4 phases, and these guide the actual implementation of the intervention. So together with PRECEED and PROCEED, there's this comprehensive framework that is ensuring health promotion efforts are evidence-based, community-informed, and systematically implemented. So the action model for community redevelopment was developed by community members to identify problems in their community and then create a plan for improvement through redevelopment. So in this context, redevelopment means making changes to physical or social environments that then have an impact on health outcomes. So looking at repairing sidewalks, removing environmental exposures, putting in a playground. So these key features are where the community members can really take an active role. So those who are most interested or directly affected by the issue then are invited to participate and shape out these redevelopment plans. So this really ensures that the solutions are local, relevant, sustainable, and supported by the community. So here are the 4 action steps of the Agency for Toxic Substances and Disease Registry. So this is the ATS-DR action model. So this model is really built around 4 steps. So the first is being able to identify what the problem is. The second is asking, why did it happen? The third is looking at the action. So what are we going to do about it? And fourth is seeing if it succeeded. So how did we evaluate it? So by working through these steps, community members develop actionable strategies to build physical or environmental changes, and then go from there to make some sustainable change. So now we're going to talk about primary and secondary data sources. So a comprehensive community assessment requires both primary and secondary data sources. We're going to first define quantitative data. So quantitative data is expressed in numbers. For example, we can look at incidence rates, mortality rates, survey percentages. Qualitative data, that's expressed in words. So that captures the perspectives and experiences of individuals and populations. Now we're going to look at primary data. So that comes directly from community members through methods such as surveys, interviews, focus groups, or windshield surveys. And then secondary data is looking at existing information. So for example, a report, right, that was collected by others. So we can think census reports, hospital records, or public health databases. So some examples would be vital statistics, so population data on births, deaths, marriages, and divorces. Health indicators, so we can look at numerical measures of health outcomes like obesity prevalence and vaccination rates. And then we want to also think about benchmarks. So these are standards or points in reference that allow for comparison of time between population. So by looking at these different data sources, we have a more complete picture of community health, and that will enable us to have evidence-based planning. So spatial data in community assessment. Spatial data identifies the geographical location of a phenomenon. So this is important in community health assessments because where people live then influences their access to resources and also their exposure to health threats. So geographic information systems, or GIS, are tools that store, visualize, and analyze and interpret spatial data. So with GIS maps, nurses and other healthcare professionals can identify patterns across neighborhoods or regions. So for example, the GIS can show areas of higher rates of opioid overdose, and then health professionals can use this to target interventions where they need them most. So spatial data makes it possible to then look at these health outcomes and then the geography and then the intervention so that it's precisely directed to the communities who are at greatest risk. So when we're looking at secondary data sources, we're thinking about public health information sources, right? So these provide data on local, state, and federal health indicators. And community health assessment teams can use secondary data sources to compare local health data with other municipalities, the state, or even national averages. So this process is called benchmarking, and it helps communities see where they are doing, what they're doing well, and where they need to improve. So these public health information sources are quantitative data sources, often measurable. They look at indicators such as disease rates, health behaviors, or access to care. So when conducting a community health needs assessment, the first step involves planning, engaging the community, and recruiting key members. On the assessment team, when we're thinking about this, we have to define the community and decide on the data collection process. So this means analyzing primary and second data collection methods with the goal to look at the strengths and areas of need, and then look at common data collection methods such as surveys, interviews, and public health data sources. Then for the collection methods, this may be surveys and interviews, like we said, and so we want to think about, okay, we need to have this data collection start, but then there also has to be an end. So the end of this phase is complete when all the assessment tasks are finished and the information that is obtained is really this comprehensive picture of the community's health. So for this next section, we're going to look at health literacy and we're going to define it. So by the end, you should be able to define health literacy and its role in health promotion, disease prevention, and then how to assess it in a population, what tools are available, and then think about and explain how people learn. So in the United States, only 12% of adults have health literacy skills needed to effectively navigate the healthcare system. There are two types of health literacy. Personal health literacy, this is the degree to which individuals can find, understand, and use health information and services. And the second is organizational health literacy. So this is the degree to which organizations can enable people to find, understand, and use the information and services, and then make these health related decisions. So both personal and organizational health literacy play these critical roles in improving outcomes and reducing disparities. So a population health literacy assessment is part of a community health assessment, and it's important to assess the health literacy level of the population. So this is needed to better understand the needs of the individuals and communities. So the health literacy levels of the individuals, the aggregates, the larger communities, then guide the plan and help tailor the health promotion, disease prevention, intervention in a way that is going to be received. So there are three levels of health literacy. The first is functional health literacy. So you can think of this as basic reading and writing skills to understand health information. The second is interactive health literacy. So this is the ability to actively engage with health professionals and then apply that information to daily life. The third is critical health literacy, so the capacity to analyze information, the question its quality, and then advocate for change and improve health. So health literacy assessment should not be a one-time task. It's ongoing, and nurses should adjust education interventions as the needs in the community evolve. There are a variety of tools to measure health literacy, and they can be applied at both a personal and organizational level. So, personal health literacy assessment tools are designed to measure an individual's ability to find and understand and use this health related information and service. So, these tools help identify where patients may need more support or a simplified communication or even just a tailored education. Organizational health literacy assessment tools look at the health care system itself. So these are used to guide organization to improve policy, practice, and service delivery. And then this will help individuals better navigate the benefit of health services. So when looking at both, nurses and health providers can promote clear communication and care and stronger health outcomes by using these health literacy tools. Learning, when we look at learning, we know that learning is a process. So when providing health education, nurses rely on learning theories and health promotion models and educational principles to guide this. So these frameworks help explain behavior and guide effective communication strategies. There are three domains of learning. So cognitive focuses on knowledge and intellectual skills. Affective domain addresses the attitude, value, and motivation. And psychomotor is the physical skill and action. So there are several theories that are applied to community health education programs. So behaviorism, this is looking at reinforcement, repetition, and practice. Social cognitive learning theory is highlighting learning through observation and modeling and self-efficacy. And constructivism, which is where learners are active participants who build on their prior knowledge. And then the adult learning theory. So this is looking at relevance, self-direction, and practical application for adult learners. So it depends on where the community intervention is happening. So if it's in a school, if it's in the skilled nursing facility, if it's looking at kind of that primary care aspect. So depending on where the need is and where the intervention is going to be, the nurse needs to then apply this theory to design health education strategies that are engaging and culturally responsive and tailored to how people learn best. And there are various factors that shape how people learn and acquire knowledge. So first, there are the learner characteristics. So we can look at their and consider things like their age and culture and language, their reading and comprehension skills, and comfort with technology. So each of these things can really influence how information is received and understood and applied. And the second is shaped by the educator's preparation and planning. So nurses and health educators need to carefully design the lesson that's clear, appropriate, and tailored to the audience. So preparation can involve choosing the right teaching strategy or right material that then will match the learner's need. So when both of these things are considered, this makes the education more effective and meaningful in the community. So now we're going to be looking at analyzing population health data and patterns. So by the end of this, you should be able to identify health patterns across populations. So comparing data at local, regional, tribal, national levels, and then looking at that in comparison to benchmarks, and then analyzing behavioral, environmental, and other influencing factors that shape population health, and then synthesizing assessment findings to prioritize education, health promotion, and disease prevention needs and resources, and also the community capacity. So these outcomes will guide really the focus when we move into this analyzing population health data section and looking at the patterns. So once the data has been collected, we now move into analysis. So this process involves, we can break it into 6 key steps. So the first would be, right, we need to gather the collected data in one place. So this is bringing information in from all the sources for review. The second is looking at it for completeness. So we have to check for any gaps or inconsistencies. The third is then to identify and then generate the missing data. So what's lacking, and then if possible, can we go back and get that additional information? The fourth is to synthesize the data and identify themes. So this is really looking for patterns to see if it's emerging through the data. The fifth is to identify community needs and problems, so highlighting areas that require attention and intervention. And the sixth is identifying community strengths and resources, so balancing these findings by recognizing and existing the different supports and assets within that area. So an example could be a infectious disease nurse who is at a school district and is in charge of collecting all the vaccination adherence rates for all of the students across different schools within the district. So the first thing would be to collect the data. So they're going to need to get this from all the different schools, bring all the information into one place. Then they have to look, are there any gaps, inconsistencies? Are there certain things missing for let's say a particular school or age? And then after that, identify and generate missing data. So if this was filled out by a survey, can they go back and ask the parent or the school district for that particular information? And once they've done that, they can synthesize the data. They can look at patterns. So are there certain areas that are not getting vaccinated, or is there a certain type, or is there a certain season? And from there, then we can highlight where that area needs attention. So is it perhaps in coming into kindergarten or 5th grade or a particular area, and then looking at, okay, well, what are the things that are working and what are the support systems that are in place either to implement this in that particular school. And then from there, this structured process allows nurses to look at this raw information and make actionable insights to guide health promotion and disease prevention strategies. Okay, so when we're analyzing data to look at health patterns and think about these factors that influence health, in this community health assessment, we have to analyze the data. So this is the statistical analysis. We want to look at the survey results or other quantitative data, look for missing or incomplete data like we said. And if, for example, we're looking at morbidity or mortality rates in the assessment. Then we want to see, okay, is there any changes from previous years or trends over time? So this allows a focus on looking at the factors influencing health. And then we can start thinking about, okay, what are the different factors? Is it healthcare access, health behaviors, environment and social conditions, or social and community contexts that are influencing this? So at this point in the community health assessment, the team needs to look at this comprehensive picture of health patterns in the community. From there, they're able to answer a few questions. So, what is the health concern? And to what extent is this concern applicable? And then, who's impacted? Is there one group in particular who's being more impacted? Where is the health concern more prevalent? And when is this happening? Then, after we've analyzed it, we need to synthesize these findings. So, critically analyzing each health concern to really identify the why and how it's occurring. So, that's kind of coming off of those questions we just asked. And then linking factors influencing health to each health concern. So, what are the common issues and needs and themes that are coming? And then each problem should be aggregated by most affected, and then looking at the community needs and gaps and the available resources. And then from there, thinking about and determining what's that capacity for change. So now in this next section, we're going to be formulating a community nursing diagnosis and plan of care. So you want to be able to utilize different approaches and assessment findings, and then appraise the level of the nursing intervention, integrate the experience and perspectives, and develop a nursing community diagnosis and plan of care. So for the health concern, once you have a problem list that has been created from the community health assessment, the next step is to prioritize that problem list. This is done by looking at the extent of the problem. So how widespread or severe is it? How relevant is it? How important is it to the community? And then what is the estimated effect of the intervention? So what potential impact is there from this intervention? So you want to look at the largest reach, the highest degree of risk, the greatest impact and opportunity, and how can there be a least adverse effect on the population. From there, you're going to develop a nursing diagnosis. So after you've prioritized your health concern, you're going to look at your diagnosis. So each diagnosis should focus only on one individual problem. It must clearly state the aggregate affected. So in other words, the specific population and the rationale. So community diagnosis is written for each selected priority using the format of population. So you're going to look at the problem among what population is related to. So think about what are the underlying factors, and then as evidenced by. So you want to think about the community assessment. So for example, risk of type 2 diabetes among low-income adults in Central City is related to limited access of healthy foods, as evidenced by 30% increase of obesity prevalence compared to the state's benchmark. So this approach allows for concise, evidence-based, actionable information and plan of care. So from here, once the priorities have been determined and the community nursing diagnosis is written, then the next step is creating a health improvement plan. So these include the goals and objectives, action steps, timelines, priority target population, indicators, and accountability measures. And here's our chapter summary. So we looked at the assessment data, health literacy analysis plan for improvement, and our goals.